All right. I see that it is 10:30, so we are going to go ahead and get started. Although we still have people joining us, feel free to continue to join, get set up however you need, but we're going to get started since we only have 30 minutes. So thank you for being here today. This is our 5th Medicaid mini. This is our last one, Coding Claims with Confidence. I'm Jessica Emmerich, your dental Medicaid facilitator with the Missouri Coalition for Oral Health. We have partnered with the Missouri Dental Association and MoHealthNet to provide you all with enrollment, credentialing, and billing support. MCOH is a 501c3 advocacy organization. We're focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about MCOH and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. At last count, we had 190 registrants from across the state of Missouri, representing both credentialed and providers that are considering credentialed. With that being said, we're here to meet you where you are and support you through the process. During the webinar, attendees will be muted, but you can submit your questions in the chat or the Q&A boxes. Both of those are at the bottom of your Zoom window. I'll do my best to keep the presentation short and to the point, so that way we have plenty of time to answer your questions at the end. Okay, so to get started. So the first part of this is going to be specific to MoHealthNet. So claims with MoHealthNet, fee-for-service claims. So you will build those claims through EmoMed, which we've already talked about several times. EmoMed is the MoHealthNet portal for providers where you can submit claims, check eligibility, check prior authorizations, see your remittance advice, and see your enrollment status. So once you are enrolled with MoHealthNet, you will get signed up with EmoMed. When you come into your portal, you will click on Claims Management up here at the top. So I'm just going to go over the basics, just submitting a very basic dental claim. For more in-depth training about EmoMed, you can click on this link here, and it will take you to the MoHealthNet Provider Education Training page, and there is a PowerPoint presentation specific to EmoMed that walks you through all the features of that software. So when you go into the claim management screen, you will click on New Claim, and you will go down to Dental. Then you will start putting your information in. So anything with an asterisk is required information. You're going to enter the information as it appears on their MoHealthNet card. Not information they're telling you verbally or what they normally go by, their given name that is on their MoHealthNet card. This patient account number, this is optional. This would be something like if your system, you identify them with a certain number and you want that information in EmoMed as well, you can put that patient account number in there if you would like. It is not required. That one is completely optional. Okay, so then you'll enter your service information, the performing provider, the provider who is actually doing the service, and the place of service. You can see notes down here that the ICD-10 code is optional, but there is a place for that. And then you will save the claim header. So once you've done that part, you will start adding the details. So again, the asterisk means required information. The date of service, the date the service was actually performed, and the providing provider MPI who actually did the service. You don't want to use your group MPI, you want to use the performing provider ID there. Your procedure code, and then the billing charges. For this billed charges, this is the number that if you were billing that patient and they didn't have any insurance at all, that's what you would put in there. So if MoHealthNet pays $50 for a service, but your office usually charges $100, don't put $50 in here, put $100. That's what would be billed. That's your billed charge. That way, if something does change with MoHealthNet and they decide to change the reimbursement rate for that code, they can go through and automatically make that adjustment and pay you that difference. If you only put $50 in here because that's what MoHealthNet normally pays, that's all you're going to get unless you resubmit the claim with a different rate. So always put what your office actually bills here. And then the unit billed, the diagnosis code, place of service again, and save. Okay, so then you'll see this line will appear over here, right here at the top, and it'll give you the option to add another one. So this is where you'll put all your claim information in and then submit your claim. So I've been sending providers a lot to the Mo Health Net provider resources. We talk about this page a lot because it has all your information here. This is where you'll find your provider manuals. If you have questions about the requirements for a code or what is required, this is where you'll find your fee schedule, what that code is, what the reimbursable rate is for that. Claims processing and payment schedule. We always want to know when we're going to get paid. So that one is right here. This tells you if you submit your codes by a certain date, this is the date you'll get your check. You know ahead of time when to expect that payment. And then, of course, our education and training resources, the one we always direct new providers to. This is where you'll find pre-made PowerPoints that go over all this information. That's where you can sign up for the live 2-hour webinars for dental provider education training. This is your provider resource page. I've provided a link here. Please refer to this page often. I still do, and I've been with this information for a long time, and I still come back to this page. If there's ever updates or changes, this is where you'll find that information. So when new providers get enrolled with Mo Health Net, we recommend they do provider education, they do a training. This is where we're going to give providers the basic information, how to navigate EmoMed, how to bill claims, so on and so forth. Here's their contact information, email, phone, register for a training. Next important piece for new providers, for the EmoMed help desk. To get signed up if you have issues or you need to create a new account or you've forgotten your password or something just doesn't look right, something you don't think is working correctly. Here's the number you can call. You can email them. They're available there to help you. And then finally, for new providers, is the provider communication. So this is your initial contact. Once you've done your provider education, you're set up with EmoMed, you've submitted your claims, something is denied, something is showing incorrect, you can't find prior authorization. Then you call provider communications. You can also contact them through EmoMed or give them a phone call, and they can help you resolve those issues. They can see the claims that you're working on. They can see the same screens you do. They can help walk you through those processes. So everything I've shared has been specific to Mo Health Net fee for service. And the reason for that is that the managed care plans, they each have their own portal. So Healthy Blue, they have their own portal for dental providers to bill their claims through. Home State has their own, United Healthcare has their own. They are all very similar, but they each have their own platform. So it'd be important to reach out to them to get an overview of their processes and some information on them. I provide their contact information, phone number, and email address, and they can provide more training on their portal. But again, they're all very straightforward, user-friendly, easy to navigate. And if you ever have issues with them, please feel free to reach out to them for assistance on that. Also, the coalition just did a dental provider credentialing policy and claims webinar series where we had each of the health plans come in. We did Zoom meetings where they presented information about their portal, their credentialing process, their policies. And so that information is available on our website. We were not able to record all of the sessions, but we try to provide as much information as we can. But we do have that information available for providers to go ahead and go look at to get an idea of what their portals look like and how to navigate them. So for more information about the EmoMed billing, I just gave you guys a very high level view of just a very simple claim. Unfortunately, we know most claims are not going to be that simple and straightforward, and you're going to need a little extra training, which is great and it's wonderful, and we're here to provide that for you. You can reach out to me for more information about those claims, or you can reach out to Lee. Lee is with the Mo Health Net Education Training Unit. She will be the one helping dental providers navigate EmoMed and start the billing process and know the ins and outs of that portal. So if you have any questions about crossover claims or spin down or anything, just those nuances that come up for providers, please feel free to reach out to Lee or I, and we'll provide you as much information as we can to help with that. And if you just get a really difficult claim that you're just new to it and you're not sure what to do, give Lee a call and she'll be more than happy to work with you and help walk you through that. Again, we want you to be paid. We want this to go correct. We don't want to see providers with a bunch of denied claims because there wasn't the resources available. So we're doing everything we can to make those resources available, to get you that education, to make that information available to you. So I know I went through that pretty quickly, but I think most of that is because of, we've covered a lot of this information already, and I can't go too in depth on the claims, or we would be here all day. That's why those training webinars with me are 2 hours, because she does go into the detail about everything that is required for the nuanced claims, for anything that might be different, special circumstances. So she will go into more about these other categories during that 2-hour training. So if you've not already, please sign up for one of those or reach out to her for more of that information. So now I want to know, what questions do you guys have as providers, as new providers, as experienced providers? What questions can I answer to about the claims process to make you feel more comfortable with submitting claims with MoHealthNet? I can't answer a lot for the managed care plans because, as I said, they do have their own processes and portals. But I will do my best to answer any questions you have. So if you have anything, please put it in the chat or the Q&A. We will start looking for those questions. Okay, the question is, are pulp caps covered under the adult plan? Without a code, I don't know that off the top of my head. We do have Amanda Farendorf with MoHealthNet on the phone. Amanda, I've given you permission to speak. Do you know off the top of your head if pulp caps are covered under the adult plan?
No, and today I'm actually traveling, so I don't have access to the information. But if you want to send an email, and I can look at that on Monday.
Yeah, okay. So I'm going to put our information back up here. So if you would send that to either me or Lee and include the code that you would build for that, and we can look at that and see if it's covered, to give you some more information on that. Okay. There's a question that says, can I access the recordings of the previous mini sessions? Yes. So now that this is the last session in our mini series, so we are going to put the recordings of all the sessions on our website. It'll be the same page that you guys use to register for the mini series. We're going to put the recap pages for all the mini sessions on there. That'll have the recording. It'll have any resources we mentioned and question and answers during that time. So please feel free to go back and review those, share those with people who may be interested, share them with your office staff. Anyone who's interested, please feel free to share those recordings. If you have trouble finding them, just send me an email and I'll be happy to send you the link. Okay. Okay. Okay, do staff have more training than they used to when it comes to answering questions about claims? In the past, whenever I called for help with MoHealthNet claims, they weren't very helpful. So yeah, I would say, I would hope they do. I have not heard very many issues about that recently. If you call provider communications, like I said, they can see your claims, they can see what you're working on, why it was denied. And if they're not able to give you those answers that you're looking for, please feel free to reach out to Lee or myself, so we can dig a little deeper and see what the reasoning behind that is. We should be able to explain if there were issues with your claims, so that we can correct those in the future. We don't want you to keep going on with the same issues. We want to be able to address those. Okay, the question is, if we are not yet credentialed with the managed care plans, but are credentialed with MoHealthNet as fee-for-service providers, can we still see people who are insured by the managed care plans? You can see people who are insured by the managed care plans, but MoHealthNet will not pay those claims because they are with one of the managed care plans. You could build the managed care plans as an out-of-network provider. I don't know what their policy would be on that, if they would go ahead and pay it or not. If you need help getting credentialed with the managed care plans, please let us know. But We would love for you to be able to see those patients, but unfortunately, you won't be able to bill Mo Health Net for those if they are with a managed care plan. So I hope that answers your question. If you have more questions about that or need help with the managed care plans, please let me know. Okay, is there a different code we can bill for periodic exams on adults? Because we are not receiving payments when it comes to periodic evaluations. Okay, so on the adult population, a different code. So there is not a different code for periodic exams. We know that coverage is somewhat limited for adults. So what we recommend for those periodic exams would be a self-pay agreement. That way you can still see them. And then when they do need additional services as a result of that periodic exam, those services could be covered, but unfortunately there is not.
I just want to jump in there and make sure we understand that's not for all adults. The general adult population, yes, they don't allow a code for the periodic exams, but there are adult populations for which you can bill that, the ones that have the full comprehensive dental. And I don't know if Amanda could jump in here and explain that more precisely.
Sure. So adults over the age of 21 have the limited benefit. However, individuals that are blind, pregnant, or residing in a nursing home will receive that comprehensive benefit, which does include that periodic exam. Now, I would like to bring to your attention that D0140, the problem-focused exam, is a covered service if it's a problem-focused thing. Now, that's only billable one time every 2 years, but that is a code that can be used, as well as DO150, which is that one time for like a new participant, one time per provider, per participant. And if there's a gap of 3 years, then you can bill that code again. So, I mean, unfortunately, the DO120 is not covered for the limited adult dental, but we are considering that. So just so you guys know, we are looking into that very seriously and looking at the fiscal impact. And so I'm hopeful that we will be covering that in the future, but just kind of, it's on the radar.
So I'll just throw in that the coalition, completely separate from Amanda's response, the coalition is looking at the adult dental benefit in particular, as well as other items. And we are having discussions about trying to impact some policy changes. Obviously, there's no guarantees about that, but we are aware of these weaknesses. That is a big one, where we recognize that is a big weakness in the way this is structured. What we ultimately want is for people to have a dental home, a dental healthcare home, and not having that periodic exam runs counter to that, and it's problematic for providers. So we're very aware of that. We are talking about that. Policy change takes time, even when we can do it. We've got a good track record, but you know, you can't get everything today, unfortunately. I'd like to say we were going to do that immediately, but it's a process. But I just wanted to let you know we're very aware of that.
Yeah, thank you for that. We know it's an area that needs to be addressed. So any other questions, discussion, anything you want to discuss, even if not necessarily from today's webinar, but this is our last one. Anything we haven't covered that you'd still like more information on, say anything specific, you can always reach out to me or Lee and we can help you address that. But we have a few minutes left. If there was anything else, any other questions we can answer, anything we can help you with. I just want to take a moment to apologize for any background noise. I am at the Missouri Dental Association conference, Connect for Success. So I apologize for any background noise, but I wanted to be sure to be here with you all today to share this information. Okay, well, while we're waiting for any final questions, I want to remind you that this information will be on our Facebook page. I'm sorry, not Facebook. They'll be on our website. And we'll also be sending out emails. Question about access to the previous mini sessions. Yes. Since today is our last mini session, we are going to put the recordings, the question and answer, all the resource documents. We're going to put all that on that same page that you registered for the mini series. All that information will be on that same page after today, since this is our last one. Please feel free to look for it there. If you can't find it, please email me and I'll send you a direct link. Feel free to share that information with other providers, office staff, anyone who could use this as a resource. We want to get the information, let providers know that this information is available. So Paige, I hope that answers your question. If not, send me an email and I will send you a link to that page with all the recordings, the resources, and the question and answers from each mini session. Okay, anything else that we've missed? Any other last minute questions? Like I said, our attendance is new providers, it's experienced providers, it's providers who are just thinking about it. So if you have a question, odds are another provider has the same question. So this is your time to ask. Otherwise, you can feel free to follow up with me or Lee afterwards, and we can help address any questions or issues you may be having. If you need help with enrollment or getting credentialed with the managed care plans, please also reach out to me and I can help you with that process. Low Health Net enrollment takes about 2 weeks. The managed care plans take a little longer, so we want to get you started on that as soon as possible if you're interested in doing that, so you can start seeing these patients. All right, well, I'm not seeing any other questions coming up. So we do have a few minutes left, but I'm going to give you those few minutes back in your day. We know your time is important and is limited, and we appreciate you taking your time to be here to hear about this information. We appreciate your interest in Missouri Health Net and providing care to these Medicaid patients who are desperately needing dental services. So thank you for being here today. Thank you for your interest. Please watch for other events that we'll have coming up and watch for the recordings of the mini series. Feel free to share these with your network. And if you have any questions, we're always available. Follow up with me or Lee, and we'll do whatever we can to help make this process easier for you. So thank you again for being here today, and we'll give you, let's say, about 5 minutes of your day back, okay? Well, thank you again, and have a great day.